Okay, let's dive in. Today we're looking at something really practical, a menopause blood test. It's about giving women, real control during a pretty major life change. Our info comes mainly from a guide by Blood Test UK, which focuses a bit on services locally, like in Cramlington.
Yeah, and fundamentally we're talking about how a simple test can empower you. It's about understanding your own body by checking specific hormone levels.
Right, so just to be clear, what exactly is this test measuring? In simple terms.
Okay, so it mainly looks at two key hormones, follicle stimulating hormone, that's FSH, and estrogen.
FSH and estrogen, got it.
Exactly. When your ovaries start slowing down production, your estrogen levels tend to drop. And in response, your brain sends out more FSH, trying to, kickstart the ovaries. So seeing high FSH and low estrogen helps confirm you're heading into menopause.
Which is really important if you're experiencing things like hot flushes or mood swings and you're just not sure what's going on.
Precisely. And that leads us straight into the benefits, which are honestly quite significant.
Okay, let's talk benefits. What's the first big one?
Clarity and control. Just knowing for sure what's happening based on the results, like the guide from Blood Test UK mentions, can really reduce that worry, that anxiety.
Yeah, I can see that. Takes away the guessing.
It does, and it empowers you. You can then go talk to your GP or maybe local experts, perhaps someone like Dr. Jane Smith at Cramlington if you're there, with actual data.
Okay, so clarity first. What's next?
Personalized help. That's the second major benefit. Once you have those results, the guesswork stops, and you and your doctor can figure out a tailored plan.
Tailored how? Like what kind of things?
Well, it could mean deciding if hormone replacement therapy, HRT, is right for you. Or maybe it shows that actually some targeted lifestyle changes might be enough.
Lifestyle changes.
Things like making sure your diet is balanced, getting enough calcium and vitamin D for bone health, regular exercise, or even stress relief techniques like yoga or meditation. It's specific to your results.
That makes sense. It's not one size fits all.
Not at all. And this ties into the third point, local support. Especially relevant for places like Cramlington, as mentioned in Blood Test UK info.
How does local support play in?
Knowing your status means you can tap into local resources more effectively. This could be your local GP practice, like the Cramlington Medical Group, or larger trusts like the Northumbria Healthcare NHS Foundation Trust.
Oh, okay.
There might also be local support groups, like the Menopause Matters group mentioned. These local networks often integrate the latest research, so you're getting up-to-date care right where you live.
So the test results help you connect with the right local help.
Exactly. And that leads to the fourth benefit, thinking long-term.
Ah, right. Beyond just the immediate symptoms.
Yes. This isn't just about managing hot flushes today. The hormonal changes of menopause can increase risks for things like osteoporosis, bone thinning, or even cardiovascular issues down the line.
So the test helps flag that early.
It allows for timely interventions. Knowing your hormone levels helps you and your doctor put strategies in place now to help prevent those longer-term health problems. It's proactive care.
That's a really crucial point. Okay, let's quickly cover the practical side, the logistics mentioned in the Blood Test UK guide. What about cost and timing?
Sure. The guide suggests the test typically costs somewhere between, say, £50 and £200.
And NHS coverage?
It is possible, but generally you'd need your GP to determine it's medically necessary and refer you.
Okay. And how quickly do you get results?
Usually pretty fast, a few days, maybe up to a week, typically.
Good to know. So relatively quick turnaround.
Which brings us to a final thought, really. A question for you, the listener.
Go for it.
Understanding your body's specific hormonal picture, it fosters a proactive mindset, doesn't it? You have this information, this knowledge, perhaps even localized info relevant to where you are. So the question is, how can you use this knowledge, this data about your body, to become the best possible advocate for your own health as you move forward, especially when using local resources?
That's a powerful question to end on. It really boils down to knowledge being the foundation for confidence, especially during big life transitions like menopause. And guides like the one from Blood Test UK provide that starting point, giving you the facts you need. That wraps up this deep dive.